what does an emergency medicine doctor do during a shift? Now this was not a very busy day here. This was a busy day, not so busy, very busy. So from day to day, you know, the acuity of the patients, the amount of patients you're going to see are very variable. So an emergency medicine doctor is probably the best doctor at multitasking. I mean, we have to be able to see this one patient, jump to this other patient, think about, okay, the first one I saw needs this, I need to reassess that patient, and you're just constantly switching in your mind from patient to patient and stuff. So let's talk about this quick. This first patient here is an 89-year-old female that presented with bleeding out of a varicose vein. It was just a tiny little spot and she was bleeding, but she's on aspirin. She was, I think, on Plavix, and then she was just pouring blood out, so we had to do some hemostasis and controlled bleeding. This next patient is a 62-year-old with chest pain who got admitted to a hospital because of chest pain because they had prior history. This next one was a 40-year-old patient with a psychiatric disorder seeking psychiatric medical clearance in the ER to then have treatment and so on. This one is a 37-year-old with chest pain, but it was more like rib pain. He was doing some heavy lifting and felt a crack or a pop in his chest, and then we had to do chest x-rays, pain management, and so on. This next one was a callback. I actually had to call the patient to come back to the ER because we saw something on the x-ray that was not initially seen on the first x-ray. Was seen later by a radiologist, and we got concerned now we needed to do a second, not x-ray, but a CAT scan to follow up on those studies. He ended up being fine, but we follow up on that. This next one is a 27-year-old with foot pain. She had injured her foot. It was a little swollen, and we did some x-rays to make sure it wasn't broken. This next one is This next one is a patient presenting with just nausea and vomiting, 7-year-old kid, and it was just a virus.